If you've been following diabetes research for the last decade, you've heard the cure story before. We've been promised artificial pancreases, stem cell implants, and miracle diets. And yet, for over 400 million people worldwide, the reality is still daily management, medication, and the constant looming threat of insulin dependence. But here's the thing, 2025 might actually look a little different. There's a new procedure moving through clinical trials right now that is flipping the script. It's not a new drug, it's not a major surgery, it's a 1-hour outpatient procedure that claims to reset your body's ability to process sugar. And the early numbers, they are kinda wild. In a first-in-human study, 86% of patients were able to stop taking insulin entirely and stay off it for 2 years. So is this finally the remission we've been waiting for, or are we just seeing another flash-in-the-pan headline? Before we dive into the numbers, we need to talk about where type 2 diabetes actually comes from. For years, we've had a very pancreas-centric view of the disease. We thought the pancreas was just getting tired and failing to produce enough insulin. But recently, there's been a paradigm shift. Researchers are realizing the problem might not just be in the pancreas, it might be in your gut. Specifically, the duodenum. The duodenum is the first part of your small intestine, right after the stomach. You can think of it as the traffic controller of your metabolism. When food hits the duodenum, it's supposed to sense nutrients and send signals to the rest of your body saying, hey, sugar is coming, get the insulin ready. But in people with type 2 diabetes, this traffic controller is asleep at the wheel. The lining of the duodenum, the mucosa, becomes thickened and dysfunctional. It stops sensing nutrients properly, and the signals get scrambled. We actually learn this by accident from gastric bypass surgery. When surgeons bypass the duodenum, patients' diabetes often vanished days before they lost any weight. It was a natural experiment that proved if you take the dysfunctional duodenum offline, the body can regulate sugar again. But not everyone wants or qualifies for major stomach surgery. That's where this new technology called ReCET comes in. ReCET stands for Re-Cellularization via Electroporation Therapy. That is a mouthful, so let's break it down. This is an endoscopic procedure. A doctor puts a flexible tube down the throat, advances it to the duodenum, and uses a special catheter to deliver non-thermal pulsed electric fields to the lining of the intestine. Now, this is crucial. It is non-thermal. Previous attempts to fix the duodenum used heat to burn away the lining. That worked, but burning the inside of your gut carries risks, like scarring. ReCET is different. It uses electroporation. Think of it like rebooting a computer versus smashing the hard drive. The electric pulses create tiny, irreversible holes in the cell membranes of the dysfunctional surface cells, which triggers apoptosis, which is just a fancy word for natural cell death. The old glitchy cells die and slough off. But because it doesn't use heat, the structural scaffolding underneath stays intact. This allows your body to regenerate a brand new, healthy lining within weeks. The goal? Replace the inflamed, dysfunctional traffic controller with a regenerated, metabolically active one that actually does its job. So that's the theory. But does it actually work? Let's look at the data. The most striking data comes from the EMINENT study, which was a first-in-human trial. They took 14 patients who were currently taking basal insulin, meaning their diabetes was advanced enough that pills weren't cutting it. They gave them a single ReCET procedure and then stopped their insulin. The result? 86% of them remained off insulin for 6 months. But here's the kicker. Usually these effects fade, but at the 12-month mark, still 86%. At the 24-month mark, 2 full years later, 86% were still insulin-free. They also looked at safety. In over 65 patients across different trials, there were 0 device-related serious adverse events, no perforations, no severe hypoglycemia. This sounds incredible, right? A 1-hour procedure and you toss your insulin pen in the trash? Well, before we get too excited, we need to talk about the elephant in the room. If you look closely at the EMINENT study protocol, you'll see a massive confounding variable. After the procedure, patients weren't just sent home. They were started on Semaglutide. That's the active ingredient in Ozempic and Wegovy. Now, a skeptic, and we should be skeptical, would say, wait a minute, semaglutide is a miracle drug on its own. Did the surgery fix the diabetes, or did the drug? It's a valid question. We know GLP-1 agonists like semaglutide are powerful, but here is where it gets interesting. The researchers argue that ReCET and semaglutide are actually the perfect synergistic team. Here's the analogy. Think of type 2 diabetes as a car with two broken parts. First, the gas pedal, your insulin secretion, isn't pushing enough gas. Second, the engine, your insulin sensitivity, is clogged and ignores the gas anyway. Semaglutide is great at pushing the gas pedal, but it's actually not that great at fixing the engine. It only improves sensitivity by about 30%. ReCET, on the other hand, seems to be an engine mechanic. In the ReGent-1 trial, ReCET alone improved insulin sensitivity by 487%. So the theory is that ReCET resensitizes your body to insulin, allowing the semaglutide to work way better than it would on its own. It's taking patients who were dependent on insulin, people for whom drugs had already failed, and making their bodies responsive to medication again. Despite these promising numbers, ReCET is currently stuck in what I like to call development hell. First, the studies so far are small. We're talking 14 people in one study, 51 in another. These were open-label trials, meaning everyone knew they were getting the treatment. There was no placebo group. The placebo effect is real, especially when you combine a fancy new procedure with lifestyle coaching. Second, we don't fully understand the mechanism. We know the cells die and grow back, but we don't know exactly why the new cells are smarter than the old ones. Are they genetically different? Do they just lack the memory of diabetes? We don't know yet. And finally, accessibility. This is an endoscopic procedure. While it's outpatient, it still requires a specialist, a hospital setting, and sedation. It's not as simple as popping a pill. So where does this leave us? Right now, the company behind ReCET is running the gold standard test, a randomized, double-blind, sham-controlled pivotal trial with 350 patients. Half the people will get the real Zap and half will get a fake procedure. This will finally tell us if the gut reset is real or just a very expensive placebo. If it works, this could be a game changer. It represents a shift from chronic management, taking pills every day until you die, to disease modification. Imagine a world where you go in for a 1-hour procedure every few years, and in exchange, you don't have to take daily insulin injections. That is the compliance-free future ReCET is pitching. For now, I'd say we're in the cautiously optimistic zone. The safety profile's excellent, the mechanism makes sense, and that 86% number is hard to ignore. But what do you think? Would you undergo an endoscopic procedure if it meant getting off insulin? Or does messing with your gut lining sound too risky? Jump in the comments and let me know what you think.